Hello, welcome to our presentation today on speech therapy. Is it for me? Today I'm with Lindsay Williams, who is a certified and state licensed speech language pathologist. And I'm Doreen Nicholas, and as well a certified and state licensed speech language pathologist. And we're going to talk today a little bit about what goes on with your speech and swallowing with Parkinson's and a program that can help you with these symptoms. First off, we do not have any relevant financial relationships with Northwest Parkinson's Foundation, financial or non-financial. So what we want to do today is our speech therapy program works on the thought of intention. So we're going to talk about what intention is, and then understand the relationship between speaking and intention, and understand the specific program that we're going to talk about today, which is Speak Out, and demonstrate to you a speech therapy session with the intervention techniques. So Lindsay and I started working with the Parkinsons Voice project in Dallas, Texas in 2013, and Lindsay and I actually went to Dallas to observe this program. The Parkinsons Voice project is a nonprofit program, and it's really built around pay it forward. So they do not charge for their services, basically just donations that they receive from the patients or some of their patients that receive treatment. The mission for the Parkinson's Voice project really hit home with Lindsay and I, and that is to preserve the voices of individuals with Parkinson's and related neurological disorders through intensive speech therapy, follow-up support, research, education, and community awareness. And the vision is to collaborate with other compassionate speech language pathologists to replicate the Speak Out and the Loud Crowd therapy program throughout the world. And so since 2013, Lindsay and I have been to Dallas 3 times. We've participated in multiple programs and trainings online and in person. We've actually done some research as well regarding this specific training program and presented regionally and nationally.
So we want to talk a little bit about speech characteristics and voice characteristics that are associated with the diagnosis of Parkinson's. One of the things that happens as a result of Parkinson is this reduced range of motion, resulting in smaller movements. And those smaller movements might impact the walking. So your range of motion and the size of your gait or the size of your steps might be reduced. Another characteristic in that reduction of range of motion might be smaller writing. You might notice that the writing gets smaller and smaller and smaller, which impacts the legibility. It impacts the ability for the individual to relay their message because people can't read it. What we're going to talk about today is the smaller voice. How, because your voice is impacted, you might become monotone. You might not be able to have those pitch variations that typically people are able to express when they're communicating. What we want to make sure is that when we're thinking about these typical speech and voice characteristics, we want you to know that the muscles become weak, not as a result of the diagnosis of Parkinson's. The muscles become weak because they're not being used to their full capacity. I think it's pretty similar to Nike's. Back in the olden days, Nike always used to say, like, move it or lose it. Okay? It's the same concept. If you're not using those muscles because of the reduction of range and motion, they will become weak. It's not a characteristic because of the Parkinson's per se. So when we think about the question, why do you have a weak voice and swallowing difficulties? You know, like I mentioned in the previous slide, it really does have to be, it has a result of those smaller movements, that reduced range of motion. But what happens with that reduced range of motion is that because you're not able to take in a deep breath, you might have insufficient respiratory support. That diaphragmatic muscle contraction is reduced, which doesn't allow you to fill your lungs to their full capacity. So if you don't have full capacity of your lungs, you might not be able to project your voice in a loud manner that people can hear. So volume also is impacted, as well as intelligibility, because of reduced movements maybe of your mouth and your lips. Okay. The other thing that can happen is decreased vocal vibration. In order to produce the sound in our speech, we have to produce vocal cord vibration. If that reduces, we're not going to be able to project our voice as well as we could if it was typical vibration. A little bit of statistics to share with you, because I think this is important for people to know. 89% of people with Parkinson's disease will have some element of a speech difficulty, and 99% will have swallowing difficulties. We'll talk about swallowing here in a minute. But what I think is pretty profound in terms of those numbers, it's estimated that only 3 to 4% of those individuals that could benefit from speech therapy receive it. So as Doreen mentioned, when she discussed the mission and the value of the mission and the vision, of Parkinson's Voice Project, their goal really is to increase this number of individuals that have access to speech therapy. So I mentioned some of the symptoms of voice disorders: that reduced volume, that reduced intonation, where your voice becomes really low in volume and really monotone. Okay, but let's talk about swallowing disorders. There's difference in severity of swallowing disorders as well as voice disorders. So some people might demonstrate all of these symptoms, and some people might only demonstrate some of them. Some of the symptoms of difficulty with the swallowing might be drooling, might be when you're eating, you notice inability to kind of control that saliva, and you find yourself in different positions drooling. Okay. Another sign of difficulty swallowing would be coughing, whether that coughing is during your eating or drinking or right afterwards. That would be a sign that you were aspirating potentially, that maybe a portion of what you're drinking per se might be going into your trachea versus your esophagus. The other symptoms could be the sensation of food or pills just getting stuck. You just feel like they're getting stuck and you can't get it down. Difficulty chewing. You know, a lot of times people have significant complaints of, gosh, I just can't eat that steak anymore. I can't chew it. It's so hard for me. That might be a sign. Okay. Increased length of time to eat. If you are taking, an hour to eat a meal, that might be a sign that there could be some things that we could do to help you. And then, of course, unexplained weight loss. If you're having all these different signs and symptoms of swallowing disorder, you might not want to eat because it's so effortful for you. And that could be something that could lead to that weight loss as well. Okay. So the best question, or the best answer I can provide you to this question at the top of the slide: can I improve my weak voice and swallow? Absolutely, 100% yes. And that's where we're going to talk about increasing your intention. What is intention and how do I implement that? And this quote is a great quote: live less out of habit and more out of intention. So what is intention? If I asked you, and if we were in person, we definitely would ask you to participate as an audience member and ask you what you thought intention was. Can't do that in this day and age, right? So I'm going to provide you a definition. Being intentional means you are doing something in a deliberate manner. You're thinking about it and then executing what you want to do. You are doing something on purpose. There's a difference between being intentional and being automatic. An automatic thing that you might do is if you stub your toe, you might say, ouch. Or if somebody says good morning to you, it's so automatic that you say good morning back. You're not having to necessarily bring intention into it to think and be volitional about what you want to do. Okay? So intention is bringing that volitional thought into it to make it more deliberate. So some examples of what might be intentional for you are a first job interview. You're going to prepare for that. Okay? You're going to practice. You are going to be an attentive listener, and you're going to answer the questions to the best of the ability. Other things that you might do is when you're driving down the freeway when it's raining. So sometimes when I drive home at night, and we've all been there, you could drive and then you're like, oh, I'm home. I don't really remember getting home because it's so automatic. You do it so frequently. But when it's raining or when it's snowing here in Eastern Washington, we have to be much more deliberate in how we drive. Okay. Exercising, if you're lifting weights, you're deliberate. Any recreation activity like basketball or baseball or tennis. And certainly Doreen and I are demonstrating intention today by giving this presentation to you.
Okay, so next we're going to go through the components of what our speech therapy program is via the Parkinson's Voice Project. And again, what we're trying to do with our therapy is make that increased effort in your speech as automatic as we can, because with Parkinson's, you do lose some of that automaticity of your speech. And so you're going to always have to think about speaking with intent forever. You've lost some of that with the loss of dopamine. So our treatment program starts very basically just trying to get you to produce your speech with intent, and then hopefully carrying that over in your daily life when you're talking on the phone, or you're having people over, or you're having a conversation with your spouse or significant other or family member, even in your own house. Okay, so what we're going to do today is I'm going to be the clinician and Lindsay's going to be my patient. We're just going to walk you through briefly what our session looks like. Okay, so Lindsay, I'm going to start our warm-ups here today, and I will demonstrate first, and then I want you to go ahead and do what I do. Here we go. May, me, my, mo, moo.
May, me, my, mo, moo.
That is great. And the reason we do this is we want to work on your respiratory coordination, which is your breathing coordination. And then also we're kind of pushing the speech production more to the front of your mouth, okay? And also you notice that both Lindsay and I really opened our mouth, really emphasized in the production of this may, me, my, mo, moo, and also added in some intonation, because we know with Parkinson's, the voice tends to get very flat and isn't as interesting. And so we really want to keep that interest in inflection in your speech. Okay. Okay. And then the second exercise we do after the may, me, my, mo, moos, in which we do 10 of those in treatment every day, is the sustained ah. And this again is working on your breath support. So again, improving that lung control and also how your vocal cords are functioning. So here we go, Lindsay. We're going to do our ahs just like this. Ah. Your turn. Perfect. And we're really working on sustaining those ahs for 10 seconds. Okay. All right, the third treatment task that we do is what we call the glides up and down. And this, of course, is not the most favorite of any of our patients. Again, we're going to really be raising our voice from the habitual pitch and try and bring that pitch up a little bit higher and then come back down. So this is really good for a couple of things. So from the speech standpoint, we get that pitch variation, again, because we don't want to have the flat speech, right? We want to have some interests and little pitch changes. And when we ask a question, we want our pitch to go up at the end. And in addition, when you change your pitch, you have some movement in your larynx that is close to what you're going to do when you swallow. So we can assume that that's going to also help maintain a good swallow. So it's like this, Lindsay. Ah, ah.
Ah, ah.
You can see that Lindsay and I are not going to quit our day job and start singing as a profession. Okay.
It's too early for the singing.
That's right. So here's just a little visual of what we're doing with our glides. We're going to start somewhere in what is a normal pitch for us and you, go up to the high, and then come back down to the low. And again, that is an exercise we do 10 times. Important to remember with these exercises is we're going to do them in therapy, and then you're going to do them for homework to start while you're in treatment twice a day, and then forever and ever once a day, because we know we can't stop exercising, we will lose it. Okay. The next one we do, and we're trying to approach more speech-like tasks, but again, using the intent, is counting or numerical sequences. And as the treatment progresses, we will increase how many syllables you're doing per breath. Again, working on coordination of breathing and your voicing. So it's going to be like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Go ahead, Lindsay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Great. And you can see that Lindsay's using lots of intent. She's really thinking about what she's saying. She's got some nice inflection in her voice. And as treatment progressed, we would maybe count to 5 or possibly even 10. Okay. Moving up the speech hierarchy again, it would be some oral reading. And so we have different length paragraphs to read, again, using that intent. Okay, so think about intent as you're up on the stage performing, and you need those people in that very back row to understand you. Or maybe you're the football coach and you need them to hear you down at the other end of the field. We don't want yelling, but we want intent, okay? Again, the length and complexity of the reading material increases as we go through the treatment session, working more towards that generalization to your speech, whatever situation you're going to be talking in. Okay. I have an example here. Okay. So I'm going to do just the first 3 here, Lindsay, for you, and then you can do them after me. Good morning. I love you. It's beautiful outside. So Lindsay, try and match my intonation as you do those as well as your intent.
Good morning. I love you. It's beautiful outside.
Excellent. And the next treatment task that we work on in therapy is trying to have you use your now newfound intent skills, but also to distract your mind a little bit by doing something else. Because of course it's really easy to sit down and do, the intent after I do it, or reading a paragraph with intent. But what we want you to be able to do is when you go out for coffee with your friends, that you're more as much as you can more automatically using your intentful speech. So we start introducing little tasks that you're having to think about, but also be thinking about keeping that speech intentful and, again, more intelligible. Okay, so it might be something as simple as this. I'm going to start the phrase and Lindsay might complete it. Up and
down,
salt and
pepper,
in and
out.
So she's having to think about the opposites, which probably is quite easy for all of us, but we're adding a little bit more complexity to the task. Now, the other thing I might do once she's doing that well is have her go ahead and read the entire phrase and fill it in. So why don't you start with the hot and?
Hot and cold, black and white, tall and short.
Perfect.
Oh,
Sorry.
That's okay. I could keep going.
We might, as we move up in our treatment sessions, we do things like simple math problems. 2 and 2 is 4, or 4 minus 2 is 2. So again, trying to get you think about other things as well as speaking with intent. Okay. And I'm going to let Lindsay talk about the specifics of the therapy sessions and also the workbook that you get when you participate.
Yeah. So speak out therapy has been researched quite frequently. And initially they recommended 12 sessions, and those sessions were spread out around 3 weeks. So the importance of this is to recognize that the intensity in which you complete the therapy program will help you obtain your target goal. And that consistency. I always tell people, if you go to the gym and you lift one weight, you're not going to get big biceps. Your guns are not going to be big. You have to do it repetitively over and over. It's the same thing. It's the same concept, but it's associated with your voice. It's voice exercise. And so while you're doing therapy, you can come to a clinic like ours. You actually could do therapy over the telehealth platform, like a Zoom meeting like we're doing right now. And your voice is monitored with a sound level meter. And a sound level meter can be on your phone. It can be an external device that measures the volume of your voice. So you'll be provided with some visual feedback as well as modeling from your clinician about what your target is. So there's a lot of good information that helps you obtain and then maintain those target levels. In addition, well, and I want to go back a little bit to the 12 sessions. Because of COVID, there was a disruption in the ability to access care. And we all know our lives were all impacted by that. Right now, there's some research being completed in terms of trying to determine how frequently somebody needs to do therapy. And so 3 days a week is great, but they're finding, and the work is still happening in terms of the analysis of the data, they're finding that even 2 times a week is adequate if the client has the motivation to continue with the daily homework that's required. Doreen touched bases on it a little bit. You are required or heavily encouraged, if you want to obtain, a real intelligible, strong voice that everybody that you communicate with understands, to complete the exercises 2 times a day. So in your session, you might be doing more trials, but at home, you're doing maybe 5 of the Ahs, 5 of these. And again, it's just practice. It's just exercise to maintain that. One of the great things about Parkinsons Voice Project, it is a nonprofit agency, like Doreen explained at the beginning of this presentation. They do take donations, but they also do a lot of fundraising. Every year in the past several years, they've raised over $1 million in fundraising. And one of the benefits of that fundraising is that every individual that has an evaluation completed by a therapist that has been trained in these procedures receives a free workbook, no cost. It's mailed to you. And that's because of the gracious generosity of donors that really want to show everybody the benefits of this program. A lot of the donors are people that participated and benefited. They want to share those great outcomes that they had with the rest of the world. So you get a book that has all of the exercises, and there's multiple days that increase in complexity of the tasks, like Doreen said. So, might start out with single syllable phrases, and at the end you're reading Casey at the Bat, or a Shakespeare sonnet. Okay, lots of writing in that. So that's a really benefit of that. So after you graduate from Speak Out, which is the individual therapy that you are completing, we want to make sure that you have the ability to maintain the gains that you made. And that's when we recommend that you start participating in something called the Loud Crowd. Okay, we advance the slide. You bet. So the Loud Crowd is great. The Loud Crowd essentially follows, or roughly follows, the same routine as an individual session, but they do it within a group setting. So you're with other individuals that have also graduated from their Speak Out. And this is a great way to give you accountability and motivation to continue to complete those exercises and continue to maintain, because we know a habit is really hard to establish, but it's pretty easy to break, isn't it? So we don't want to give you that opportunity to fall back on that voice. We want you to be accountable and have motivation to complete those exercises. The other benefit of these groups are you're with your peers. The peers provide support and encouragement. It's such a great supportive environment that really keeps people coming back and back. We've had members that have been coming to our Loud Crowd for, probably some of them since, 2013. Mm-hmm. And it becomes kind of a family, but people hold each other accountable as well. People might say, gosh, Doreen, you've missed like 3 weeks. Why haven't you been here? And it's just a nice element to have both support and encouragement, as well as solidarity with your peers.
So if you are interested in receiving services for speech with the Speak Out program, you can do a couple things. One is to go to the ParkinsonsVoiceProject.com website. And you can look for providers in your area. So if you're in Idaho or Washington or Montana or Alaska, you can look and see where there are some trained providers. If you are interested in the Spokane region or somewhere close and want to receive services, you can call our clinic at the EWWSU Speech and Hearing Clinic, 509-828-1323, or email Lindsay and I as well if you have any other questions. So you're welcome to come and check out our Loud Crowd. And I think probably one of the reasons Lindsay and I were so interested in this program the first time we went to Dallas was observing the Loud Crowd group and talking to the group members and asking them why after 5 and 7 years they still came to the weekly group therapy session. And their answers were, because it keeps me accountable, it keeps me doing my exercise daily, because if I don't and I walk in here, the speech therapists are going to know. So that's really, after talking with them in Dallas, Lindsay and I came home just eager to get this project started. So we hope that you will be one of the 3 to 4% and maybe make it 10% of people who have Parkinson's who really would benefit from speech therapy, making your voice more intelligible, holding on to that swallowing ability for as long as you can, and doing the exercises daily so that you can communicate for the rest of your life well. Please call us with any questions. Please call for an appointment. We're happy to talk with you, and have a great day.
Thank you so much.